With the increased popularity of medications like Wegovy and Ozempic, many folks who are losing that weight may be looking for help afterwards to take care of some of that loose skin. And joining me today is Dr. Asfa. Thank you so much for joining me today on this Medical Monday.
Thank you for having me here. Yes, this medication has helped lots of people to lose weight. So it means that not everyone needs to have any kind of surgical procedure to lose weight. So when they lose weight, they're going to end up another problem with them, which would be skin laxity or some unwanted stubborn fat area that they cannot get rid of it. So these are the people who eventually going to see a plastic surgeon to address those issues. But who is the candidate for that one? First of all, the individual has to have some skin laxity to address that one. If somebody has tiny area and is not that much skin laxity, probably the skin going to shrink by itself and there is no need for any surgery. But when it comes to the massive weight loss, we're talking about people, they lose about 40, 50 pounds. Definitely they're going to end up some problem that needs to be addressed by plastic surgery.
All right. And you mentioned who would be a candidate. So what are the most popular procedures that you all see at your office?
The most popular surgery, as we see, is the procedure that we do for body contouring. Number one is the tummy tuck. They lose weight, they end up some skin laxity of the lower abdominal area that we see. And let me go back to this one. For example, this lady lost weight and end up to the excess skin, excess fat in our abdomen, and abdominoplasty is one of the most common procedures. But we have to remember that individual has to be healthy. Individual has to be completely ready for surgery as far as time-wise. If somebody taking those medication and they still losing weight, that's not the right time. They have to wait at least for the 3 to 4 months to make sure that the weight is stable. Otherwise, they're going to require another surgery. So stability of the weight is one of the most important factors. Another one is non-smokers, because when they smoke, complication rate is going to go higher. For example, this lady, she also had the same thing that we see that before and after. They get a very nice body contour. After abdominoplasty, we do some liposuction as well. But the most common second one would be the breast surgery that we do for these patients, either lift or implant or combination of both of them. Another one that we see most of the time, they struggle with their arms, skin laxity with the arms area. This is also another thing, when they lose weight, they end up to the more cellulite, which is an office procedure we can perform for these patients to improve the cellulite of the gluteal area as well.
All right, and if folks are interested in any of these procedures, they're losing that weight, and they want to take care of some of that pesky issues that they're having, how should they go about contacting you?
Well, they call the office. I would be happy to see there was a consultation, but they have to remember that the weight has to be stable. Individual has to be not that much medical problem. Somebody who has asthma, who have heart disease problems, who have some other issues, they will not be a good candidate. But we have to be realistic about the results that we're going to achieve and realistic about this condition of the patient's health to make a decision about these surgeries.
All right, lots of good information here as always, and thank you for your time
My
today.
pleasure. Thank you.